Hello everyone, I'm Vanessa Montilia, Physical Therapy Intern from Arthur Medical Foundation in Tacloban City. And for today's video, we're going to be talking about cervical radiculopathy.
There are 8 pairs of spinal nerves in the cervical spine labeled C1 to C8. Each one is named after the vertebra beneath it, except the C8 nerves, which are above the T1 vertebra. These nerves play important roles in sending messages to and from the spinal cord, enabling the brain to communicate with other parts of the upper body. So what is cervical radiculopathy? Cervical radiculopathy is often referred to as pinched nerve in the neck. It is defined by the pain that may radiate or extend from the neck to the shoulder, shoulder blade, arms, or hand. Despite the somewhat strange name, radiculopathy can be quite painful. Radiculopathy comes from the word radix, which means root, with the nerve root being the frequent site of nerve pinching. The condition affects about 85 out of 100,000 people and most often occurs in people in their 50s. Athletes, heavy laborers, and workers who use vibrating machinery are commonly affected. People who sit for long periods or those with arthritis in the neck region can also have the great chance of having cervical radiculopathy. As mentioned earlier, radiculopathy generally occurs with the irritation of the nerve root as it exits the spinal column. This irritation can be due to several reasons, and this includes physical compression of the nerve by either herniated disc material or by degenerative bony spurs arising from the neck. Or it can also be caused by chemical irritation from swelling around the nerve root. Aside from its common symptoms mentioned, the worst pain is often felt farther down the arm than in your neck. Compression of the nerve may also lead to impaired nerve function, meaning you may have areas of reduced sensation in the arm or reduced power in muscles supplied by the compressed nerve. An effective treatment of radiculopathy begins with a thorough examination to determine the root cause of the dysfunction. Once the exam and diagnostic process is complete, your physician will work with you to determine the most appropriate course of action for treatment. In most cases, cervical radiculopathy is first treated conservatively. This may include rest, anti-inflammatory medication, and activity modifications. Your doctor may refer you to physical therapy to work on reducing the compression and inflammation of the nerves in your neck. If the pain in your neck and arm does not resolve with these conservative measures, your doctor may recommend you to have an injection of anti-inflammatory medication or cortisone directly into the region of nerve compression. That's it for today's video. Thank you for watching!